Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Debbie Whisenhunt. She's the billing supervisor and the food pantry coordinator for Dr. Randy Walker's clinic in DeQueen, Arkansas. Debbie, thanks for being here.
You're welcome. Thank you for having me.
So tell us about your role as the food pantry coordinator and what you do.
As the food pantry coordinator, I am responsible for making sure that we have all of the supplies that are needed, and we make up bags so that they are ready for each and every clinic, that they just have to get them off the shelf. I go out into the public, and we have what's called blessing boxes that I'll talk about a little bit later, and we stock those and make sure that those are full as needed.
And how did the clinic identify food insecurity as a need to address among its patient population and community?
Well, the wellness package that we do, the preventative, is one of the main questions on all of our preventatives that we do, whether it's children or adults. And back several years ago, I'm not sure what year exactly, the senior citizen here, the food office was having to shut down. Things were getting hard, budgets were getting cut. So Angie saw a need. So during our presentations with our wellness plans, they were asking, how do you feel? Are you depressed? Do you have housing? Do you have food? And we found a big need for it. So we did research out there, and we found out that Sevier County is like 26% in the poverty level with children in the household. So we just got on board, and that's how it all got started.
And how does the food pantry align with the clinic's mission? So it's a holistic, very patient-centered care approach.
Yes. We feel the need that when you're doing those, when you're hungry and your children are hungry, or you as a parent and your kids, you feel like your kids are hungry, that brings on a lot of onsets to different things, your depression, your anxiety, and different things. If you're diabetic, it affects that. If you are obesity or underweight, then we saw the need that was something that needed to be addressed from older to younger. And so we try to address that, and we coordinate with the nurses up front and see what's needed. We, like I said, we put them in every clinic, so every age is available.
It helps managing chronic illness, improving nutrition and supporting recovery for your patients as well.
Yes. Yeah. Well, nutrition is very, very important to our body, to our function. And when we're hungry, we don't sleep well. If we're hungry, we don't think well. For children, they can't function in school because they're hungry and maybe they didn't get anything to eat the night before. So if you're a diabetic, your nutrition is very, very important to your health and the way it's treated. Like I said, if you're obesity or if you're underweight, it really, even in cancer patients, they have certain diets, sodium diets that they need to do. So we also have the nutritionist that comes to help us along with our food bags that go out so that we can help address that through any need that they have.
How does the pantry function as part of addressing social determinants of health in a rural setting like DeQueen?
In the rural areas in DeQueen, like I said, we're 26% poverty and way above the Arkansas level. And so it reaches out to social so that they have it in the schools, so they have it in the blessing boxes, so we can have the bags ready in the pediatric clinic, the main clinic, we have the Dairies clinic. They all are stocked with them. We try to put something to each one in there, whether it's breakfast, lunch, children coordinated, the things that they like, things that can be easily opened so that you can go out into the community in those food boxes. I think at the last count, we had like 22 blessing boxes in the community. So that is there and available. They can go get what they want. They can take it all or just take what they need and leave it for the next person. So it helps out into the community across the county.
And you mentioned blessing boxes. That's something different than the pantry, or what is it? Work hand in hand?
They work hand in hand. To me, they work hand in hand because the food pantry supplies the need here in the clinics. The blessing boxes, Angie produced them and we provide them to businesses who want to help the community. And the businesses and the local churches help stock those as well as our food pantry. So we work hand in hand together. If I go by on Friday evenings and I see one is empty, then I take it out of our food pantry and I put it in there. So there's always an availability for the community.
And when you say in the community, are there specific, it's like partnerships, community resources that you all help coordinate to make sure, or partnerships with those blessing boxes?
Yes, we do. We try to supply the foods to the ones that are smaller businesses, and especially our businesses. We take out of the food pantry and take there, so it's always available for them. But we have Feed Local. We have a church that here is local that does a food drive, so we coordinate with them and we work together so that all the kids, especially the children, we do the county schools. We help make sure the county schools have food at all times ready and available for kids who don't have it.
So it really helps reduce barriers for vulnerable populations.
Yes, and it is there also is we are a wide variety in nationality. We have a lot of Hispanics. We are one of the biggest Marshallese in Arkansas, from what I've been told. So we have probably over 300 Marshallese here now. So we make resources guides. Angie has made them up. The resource guides gives them every possible avenue they could need, whether it's food, whether it's housing, children's counseling that's out there. If you need help for utilities, we work with them to make sure that resource is out there in Spanish, Marshallese, and English so that it's ready and available. And there is one put in every bag that goes out of every clinic.
And how is the food pantry integrated into clinical workflows? Do providers refer patients directly based on screenings, as you mentioned earlier?
Yes, the providers and the staff all know the questions that have to be asked, especially when you go back to the social aspect of it, and they ask them. They also ask them how many's in the household. So if they have bigger households, then we know they need more. They are not limited on how many bags they can come and get. We prefer they get one at a time, so we do have the availability. But those nurses know if there is a patient that has a low sodium diet. They kind of let me know, and I go through what I've got and I make sure that that is accessible to them when they need it. Diabetics don't need a lot of sugar issues, so we go through it and we make sure that we make that bag according to what they need through the nursing staff.
And there are some key partnerships and resources of support for keeping the pantry stocked and sustainable?
Yes, ma'am. Feed Local is really our greatest asset on this. But also, we have a very competitive group of employees, and I have a very competitive boss, which is awesome. But we did a challenge. We've done it twice through our employees to see what team could win. And she always puts a prize up there for us. It might be a vacation day. You never know. We might get a spa day. And the last competition we did over 5,000 items through the food pantry, through the employees themselves. The first time we did it, we had a 16-foot trailer. I don't really know the count, but it was packed full. And we put that to the senior citizens to make sure it could stay open. So we work with anybody out there that is willing to work with us, but the food lot is the biggest, and the churches do help a lot too.
Mm-hmm. And are there any innovative approaches you've used, like for mobile distribution, even culturally responsive foods or fresh produce programs?
Angie has done those. I don't keep them here because I don't have any way to keep them. But what Angie has done is last year we did a truckload of potatoes. She bought a truckload of 50-pound potatoes, and those patients that wanted them in the community could just drive by, and she put them in 5-pound bags, and they could get 2 bags if they had a big family. They didn't cost them anything. They just actually drove through, didn't even have to get out of their car. It was put in their car for them. This year, we did fresh field corn. She bought a 16-foot trailer full of 50-pound bags of field corn, and they got to drive through and get the bags. They put them in 15 or 30 ears bags, and they could just drive through and pick them up. They didn't even have to get out to get those. The church up here does a lot of vegetables because they have the space to store them. So we send them there if they need anything special. But we do keep applesauces. We keep the little canned fruits. We keep the little Jell-O mix ones and things like that put the produce out there for the kids.
And before we go, what do you want healthcare providers, funders, policymakers to understand about the role of food access in rural health equity?
Well, the main thing to know is that it is a need. There is a need out there. And I was so surprised how many children in our school systems along the county that don't have access to food. And maybe they don't have access to things that they can make at home. And so I would love to see more people get into do the blessing boxes, do another step, let the government or the county officials know that need is out there so that they could help maybe do another one. I know that they have started another pantry here locally through Horatio. So that has opened that door up through our food pantry. We also this summer had a group of young kids that came from Bog Springs Church Camp, and they needed to do service work. So I would love to see other groups do this. It was only their senior classes, and I don't know, probably 10, 15 kids came. They delivered the food boxes to our homebound patients. They did housework for the homebound patients. They did some yard work. We do deliver out to our homebounds, and we do have some critical patients out there that are in need. So if you have a group out there that is needing to do some service hours, this is a great way to get them in there to help the elderlies and the disabled.
Well, Debbie, thank you so much for talking about this important work. And it's so innovative in terms of just what the clinic and your staff is doing for rural populations that I know other healthcare providers can learn from, just really forward thinking to meet the community and patients where they are.
Yes, I love doing this pantry. It has been my overjoy to be able to see how you affect others out there in the community. And I really encourage all the other clinics to get on board with it because it is an amazing feeling.
Well,
I'm proud that Angie let me do it.
Well, I am too. And, Angie Walker and Dr. Walker are doing amazing things in Sevier County.
Yes, they are.
Thank you so much for being here today.
Thank you. Thank you very much.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.